This is Dr. Joe Pizzona, board certified urologist with bestcme.org. I am so excited that you decided to purchase this video series on urology. I'm hoping that you're going to find that this is the most exceptional CME activity that you've ever done. I love teaching. I've been out in practice for 10 plus years, and I've been so frustrated by the material that's out there. So it's my goal for you to leave not only this video, but the other 9 with practical information that you're going to start using today in clinic. So why don't we get started on our first video here on hematuria. I'm going to start off every presentation with clinical pearls. If you learn nothing else over the next 30 minutes, I want you to at least take home these 3 teaching points. I'm going to drill them into you over and over. You're going to think it's ridiculous and probably be a little annoyed, but that's the point. The only things you remember are things that you hear repetitively. So here we go. Number 1, please do not work up isolated dipstick hematuria alone. Number 2, significant hematuria is defined as at least 3 to 5 red blood cells per high power field on a microscopic analysis or one-time gross hematuria. There are some caveats, I'll get to those later. And lastly, imaging and cystoscopy are mandatory in terms of our evaluation. It's important when we talk about hematuria, we're all on the same page and talking about the same thing. So we first think of dipstick hematuria, right? That's where we do the little point of care tests in our office. Used to be the little color-coded strips, and now we have automated machines. Well, this is great for screening purposes. When it's negative, it's a great test. But when it's positive, we have to confirm with a follow-up microscopic analysis. So what we see there in the bottom part of the screen is a microscopic field full of red blood cells. And then lastly, we have gross hematuria. Sometimes it's very obvious, like a Foley bag full of red urine, and other times it's more subtle. Patients will describe a pink-tinged urine. Sometimes they confuse dehydration and a dark yellow urine for blood. And other times our female patients will explain some blood with wiping. Regardless if it sounds like hematuria, it's better off that you work a patient up than ignore it or try and sort through what exactly they saw. Well, when would you not send someone to a urologist? Well, number 1 would be when you suspect more of a medical renal disease picture, so like a glomerulonephritis. Here you're going to see proteinuria, red blood cell casts, might be a younger patient, maybe even some renal insufficiency. So here you're going to shuttle more toward a nephrology consultation. Again, if we find just dipstick hematuria, so you do the dipstick, it shows trace or small amounts of blood, you do a follow-up microanalysis and there's no red blood cells, you do not need to refer that patient. So I warned you I was going to drill it in your head, so here we go. We're going to go over this 3 different times in the presentation. So clinical pearl number 1, dipstick hematuria alone does not warrant an evaluation. Now, a great question is, well, why not? Well, the reason is that when you have 0 red blood cells on a microscopic analysis, but trace or small blood on a dipstick, the likelihood of GU pathology is pretty much 0. So rather than put that patient through the anxiety of worrying there's something wrong and the time and money commitment of doing an evaluation and referral, you can feel comfortable and safe that if it's just dipstick, no further workup is needed. So again, when is a workup needed? 3 to 5 red blood cells on a microscopic analysis or one-time gross hematuria. I always like telling this story to remind myself that you can't ignore even one-time gross hematuria. But it's unfortunately a sad story. Had a patient, he was active with martial arts. He said a year prior to presentation, he was kicked on his side, had gross hematuria. He assumed his kidney was bruised, didn't seek medical attention. Well, unfortunately, by the time I saw him, he had a very large renal mass that ended up being a bad cancer that was probably there the year prior. So that's always a good reminder that all it takes is one-time gross hematuria and an evaluation should be made.